This is the Possible Care for Dogs. The podcast begins.
Welcome to a new deep dive. Today, we're really jumping into the world of boxer dogs. You know, those incredibly lovable, super energetic, and, well, very expressive dogs. We're going to explore their health and care using excerpts from a guide called the Boxer Health and Care Guide. Think of this as us digging through it together, pulling out the really essential stuff, the best practices for anyone who loves a boxer or is maybe thinking about getting one. They've got these amazing personalities, right? Total clowns sometimes. But because of that energy and just their makeup, understanding their specific health stuff is, well, it's crucial. Our mission today is basically to sift through this guide, find those key nuggets so you can help your boxer live a really strong, really joyful life.
Exactly. And while their spirit is just fantastic, the guide is pretty clear that boxers do have known tendencies towards certain health issues. The real takeaway message is that being proactive with their care isn't just like a nice to have, it's vital. From when they're puppies all the way through their senior years, it's really about being prepared, being informed.
Okay, right. So let's unpack what this guide actually says. It highlights a few major health areas needing special focus. First one, and it sounds like a big one for boxers, heart disease. What does the source material tell us specifically about the heart conditions they might face?
Yeah, the guide goes into detail on two main heart conditions they're prone to. First, there's subaortic stenosis, SAS. That's basically a narrowing just below the heart's aortic valve, makes it harder for blood to flow out. But maybe the one that gets more attention because it's so linked to the breed is arrhythmogenic right ventricular cardiomyopathy. Thankfully, it's usually just called ARVC, or sometimes boxer cardiomyopathy.
Boxer cardiomyopathy.
Yeah.
Wow. Okay. That sounds very specific. How common is ARVC then, according to the source?
This is where the numbers are, well, pretty striking. The guide mentions findings indicating ARVC can affect somewhere between, say, 30% and even up to 50% of boxers in certain areas or certain bloodlines.
50%. Wow.
Yeah, it's a high potential rate, and that's exactly why it's such a major focus in the guide.
Okay, up to half in some groups. That really hammers home why you need to be on top of it. So based on the guide, what are the actual steps owners should take? What's the advice?
Well, the key recommendation, really driven by those numbers, is annual cardiac screenings. And the guide suggests starting these fairly early, ideally from age 2.
Age 2.
Yeah. And if you're getting a boxer puppy, the material really stresses talking to the breeder. Ask them directly for recent test results, specifically echocardiograms and Holter monitor tests for the parent dogs. Gives you a window into that genetic background.
Right, checking the parent's history. Good point. And beyond the vet checks, what about, day to day? What symptoms should we be looking out for?
Keep an eye out for things like any unexplained fainting or sudden weakness, even persistent coughing. The guide notes these can sometimes be subtle signs that something isn't quite right with their heart function.
Yeah, to annual checks from age 2. Ask breeders about tests. Watch for fainting or weakness. Okay. Moving from the heart, the source flags another really serious concern, cancer.
Yes, unfortunately, the guide does confirm that boxers are one of the breeds with higher rates for certain types of cancer. It specifically calls out mast cell tumors and lymphoma. The source actually cites the Veterinary Cancer Society, saying boxers rank in the top 5 breeds for both of those cancers.
Top 5. That is concerning. So how can owners be proactive here? What does the guide suggest?
The main thing for early detection is really practical. It recommends making monthly lump checks just part of your routine. Like when you're grooming them, just take a minute to feel all over their body, get used to what's normal so you notice anything new right away.
Makes sense.
And then, of course, report any sudden weight loss, or if they seem really tired all the time, or you notice swollen lymph nodes, get that checked by a vet promptly. Oh, and there's a specific mention for white boxers, too. They need extra care with sun exposure because they're more prone to skin cancer.
Right, so regular feel-overs during grooming, watching for sudden changes. Crucial. Okay, let's shift to something you immediately notice about a boxer, that short snout. The guide talks about brachycephalic syndrome.
Indeed. That characteristic pushed-in face, while totally part of their charm, is the direct cause of brachycephalic syndrome. And it's not just one single thing. It's usually a combination of features like narrowed nostrils, maybe an overly long, soft palate, sometimes a collapsed larynx. All these things can restrict airflow and, well, lead to breathing difficulties.
Ah, so it's a collection of issues all stemming from that short face, impacting their breathing. How does the guide suggest managing this, especially since they're such energetic dogs?
A lot of it comes down to managing their environment, particularly around heat. The guide is really strong on limiting intense exercise when it's hot or humid. They just can't cool down effectively by panting like dogs with longer snouts.
Okay.
So providing a cool indoor space, ideally with air conditioning, good ventilation, that's essential. And the signs to watch for aren't just snoring, though they often do, but look for like labored breathing even when resting, excessive panting, or just getting overheated much faster than other dogs.
And there's something specific vets need to know too, right, related to this?
Yes, the guide brings that up, referencing the AVMA. Brachycephalic breeds like boxers generally have a higher risk during anesthesia. Because of their airway structure, vets often need to use modified procedures and monitor them extra closely during surgery. It's really important your vet knows you have a boxer and is prepared for that.
Good point. Not just daily life, but vet procedures too. Okay, and the last major health issue the source covers is degenerative myelopathy.
Right, degenerative myelopathy, or DM, it's a progressive neurological condition. Affects the spinal cord. It typically starts with weakness in the back legs, kind of a wobble or dragging, and unfortunately it tends to worsen over time, eventually leading to paralysis. The guide notes it's usually seen in older boxers, often starting around age 7, maybe later.
And given it's progressive, what does the guide suggest owners can do about DM?
Well, there's no cure, sadly, but the guide suggests keeping a close eye on their gait, their reflexes, as they get older. Noticing subtle changes early is key. It does mention genetic testing is available now for DM. That's definitely something to discuss with your vet to understand the potential risk for your dog. And while you can't stop it, the guide suggests things like physical therapy and maybe certain supplements might help prolong mobility, maintain a better quality of life for longer.
Okay. So these health risks are serious, no doubt, but the guide seems to offer a clear path for, proactive steps, which leads nicely into the next part, how we support their overall health, their vitality, through lifestyle, daily care, kind of building on these health points. Let's talk nutrition first.
Right. The guide really links nutrition to their build and energy. Muscular, active dogs need the right fuel. It highlights key things like lean protein for muscle, antioxidants for general health, and taurine.
Taurine, again, yeah, connecting back to the heart health discussion. What specific food recommendations does the source make?
It suggests looking at large breed formulas. These are often designed with joint support in mind, which is good for boxers, and can also have heart-healthy nutrients. Specifically, the guide says to look for diets with omega-3 fatty acids and taurine, making that explicit link to supporting heart function. Also, things like glucosamine and chondroitin joint supplements are recommended maybe starting around age 5 just to support those joints as they age.
And things to maybe avoid.
Yeah, it suggests limiting fillers like corn, wheat, or soy, which the guide implies offer less bang for your buck nutritionally for this kind of breed.
And that specific mention of taurine, was there research behind that?
Yes, exactly. The guide points to a 2023 study that found a link between diets low in taurine and a higher risk of dilated cardiomyopathy, especially in breeds already predisposed like boxers. So it really reinforces why ensuring adequate taurine is flagged as pretty important by the source material.
That connection is really clear. Okay, what about grooming? Boxers have short coats? Seems easy enough, right?
Yeah, their coat is definitely lower maintenance than many breeds, that's true. But the guide stresses that basic, regular care is still important. Weekly brushing is good, keeps the coat healthy, sheds loose hair, but crucially, it's also that perfect time for the monthly lump check we talked about for cancer detection.
Ah, good tie-in.
Exactly. And bathing, maybe every month or two, or just whenever they get really grubby.
Are there specific areas needing more attention?
Definitely their facial folds. Need to keep those clean and dry regularly to prevent infections. Same goes for their ears. Regular cleaning is key. And the guide also gives a heads up that boxers can be prone to allergies, both food and environmental. So keep an eye out for itchy skin, redness, that sort of thing during grooming too.
Okay. Now, exercise. This feels like a non-negotiable for a boxer. How much does the guide say they need?
Oh, it's huge for them. A major part of their well-being. The guide recommends a pretty significant amount, at least 60 minutes of vigorous exercise every single day.
Vigorous, okay. Not just to walk around the block then.
Exactly. This is about activities where they can really run, play hard, burn off that famous boxer energy.
What kind of activities work best for them?
They seem to really thrive on things that mix physical effort with using their brains. So things like agility classes, obedience training, even just really energetic games of fetch are great. The guide also suggests using puzzle feeders or playing training games inside. It helps with mental stimulation, stops them getting bored.
And boredom is bad news for a boxer.
Well, yeah. The guide notes that without enough physical and mental outlet, they can definitely develop problem behaviors, digging, chewing, just general restlessness, often out of boredom or frustration. There's research mentioned, too, confirming that active breeds like boxers who bond strongly with people really benefit from structured play and consistent engagement. It helps keep them happy and well-behaved.
That research really nails it. Exercise isn't just physical, it's mental and emotional for them, too. Okay, so pulling all this together, the guide also seemed to lay out a kind of preventative vet care schedule. Can you summarize the key checks?
Yeah, it kind of recaps the proactive stuff we've discussed. So that annual heart screening echo and Holter monitor starting by age 2. Annual blood work is a good idea, helps establish a baseline, and might pick up early signs of things like cancer. Regular checks for eyes, joints, teeth, that's pretty standard but still important. And like we mentioned, talking to your vet about the genetic tests available, especially for ARVC and DM, is definitely worthwhile.
We've covered a lot on the physical side, health care, vet checks, but the guide also talks about what makes a boxer, well, a boxer. Their personality, their emotional needs.
Ah, yes. This is the really joyful part, isn't it? The guide describes them as, incredibly clannish, super loyal, real cuddlers. They just thrive on being connected with their people.
They definitely seem like dogs that need their humans.
They really do. The guide emphasizes that they need attention. They don't cope well being left alone for really long stretches. Training-wise, they respond best to positive reinforcement, upbeat methods. Keep it fun. They form incredibly deep bonds with their families, and they're often fantastic with kids, gentle, playful.
But they have a sensitive side, too.
Absolutely. The guide notes they can be quite sensitive to stress or tension in the home. That behavioral study I mentioned earlier, it found boxers do best with routine, lots of affection, and enrichment. In that kind of environment, they actually show fewer anxiety issues than average. So creating that stable, loving home isn't just nice for them, it directly impacts their emotional health.
Okay, wow. We've really unpacked a lot from this guide, from those specific, quite serious health risks like ARVC and cancer and the proactive checks needed, right through to their diet, exercise needs, and that huge need for connection. As you've been listening, maybe thinking about your own boxer or one you're hoping for, you can really see why this info matters, right? Knowing about ARVC prevalence isn't just a scary stat. It explains why that annual heart check from age 2 is so vital. Understanding brachycephalic syndrome makes sense of why you need to be careful on hot days. It's about taking these specific insights from the source and turning them into real, thoughtful, proactive care, making sure your boxer doesn't just get by, but really truly thrives.
Exactly. It's not just about collecting facts, it's about building a practical plan, tailored specifically for boxers that hopefully leads to a longer, happier, healthier life together.
So, wrapping up this deep dive into the Boxer Health and Care Guide, I think the main takeaway is pretty clear. By understanding their specific health risks, their physical needs, their emotional hardwiring, and then providing that proactive, consistent, loving care based on all that, well, that's how you pave the way for a really vibrant, tail-wagging life for your boxer.
And honestly, what you get back is just immense. A well-cared-for boxer brings so much joy, loyalty that's just unwavering, and let's be honest, endless entertainment. They will definitely leave slobber on you, probably steal your spot on the sofa, maybe nick the blanket, but they absolutely steal your heart too. They leave a huge, wonderful mark.
They really, really do.
Yeah.
So given everything we've dug into today, those specific health points, their big need for exercise and mental stimulation, that deep desire for connection, maybe just take a moment to think about this. What's one small, doable change or maybe addition you could make this week? Something to better meet your boxer's specific needs, maybe based on something we talked about, and just strengthen that amazing bond you have.
Yeah, just let that sit with you. How can these insights maybe shape what you do starting right now?